This is Trevor and Technology Case Study Presentation by Molly O'Connell and me, Seth Lee. For our case study, number 3, Trevor and the Technology Tricia Nunn, Texas Women's University. Trevor Wilson, RDH, BSDH. How great that sounded, especially as Trevor began his brand new job, a job that at least 2 of his classmates wanted as badly as he did. Dr. Reeves not only seemed to have the same philosophy as Trevor, but she paid exceptionally well, and the office is state of art. On his first day, Trevor was thrilled to have made it through the first 2 patients without going over the allotted appointment times, and he did everything just as he had learned about standard of care. The third patient of the day was 21-year-old Kyla Ballantyne. Dr. Reeves requested that Trevor use the electronic carrier detector because Ms. Ballantyne was new to the practice and had not had a thorough heart tissue assessment. Trevor even gloated a little because he was very familiar with the device. Trevor charted only one reading that strongly indicated a carious lesion, but he also noted several very borderline readings on the chart because he knew Dr. Reeves was a perfectionist and would want to know all possible trouble areas as she was evaluating potential lesions visually and tactily during the examination. Dr. Reeves sat down for the examination, chatted with Miss Ballantyne, and scanned the dentition with a mouth mirror. She looked at the charting of the potential carious lesions and said, "Kyla, you have a significant number of problems. It looks like you're going to need 11 fillings. We'll want to do white ones, of course, because of the bad news about our trusty silver fillings. The ballpark cost will be around $2,100. Trevor, make sure Kyla gets on my schedule so that we can get all these carious lesions taken care of before she gets into trouble. Have the girls up front schedule quadrant by quadrant." Trevor sat dumbfounded. So here's our case study, and we're going to start at number 1, identifying the ethical dilemma or problem. So just looking through, Trevor suspects that Dr. Reeves may be recommending unnecessary restorative treatment, which could harm the patient financially and ethically, but challenging her could have effects of his employment, especially with his relationship as a new employee, being a employee and employer relationship. Um, Another ethical question we can ask is Dr. Reeves abusing the patient's lack of oral health knowledge to ensure that a profitable outcome would be the outcome of Kyla Ballantyne's treatment? Moving on to number 2, collecting information. From our case study, we see some very standout information. For example, Trevor indicates only one confirmed carious lesion and several borderline readings. Aside from the 11, only one of them would quantify for the fillings. Dr. Reeves, despite only having one confirmation, decided to push for the 11, which was quite pricey for Ms. Ballantyne. The patient is young and new, being 21 and new to the practice. Her inexperience may lead her to trust the dentist's diagnosed question, um, preferably from being inexperienced, a little naive, and generally trusting that the doctor has the best interest for her. And finally, Dr. Reeves ordered, without the patient's discussion or consent, that treatment be scheduled. There was no treatment counseling, no insurance adjusting, or patient autonomy that was considered when scheduling this treatment. She simply just told Trevor to go make it happen. So moving to state 3, stating the options. When looking at what Trevor can do, he could opt to do nothing and just follow Dr. Reeves' instructions, which would violate the patient's autonomy, which would go against patient understanding or competence, medical competence. In another option, excuse me, he could privately discuss his concerns with Dr. Reeves. He could also privately talk to Kyla, informing her of patient autonomy, making sure she is dentally competent and that she knows what the doctor is talking about. or even talking about insurances, what may be covered, what not be covered. He could advise Kyla to seek a second opinion or guidance from a professional ethics board. Or if he chooses to do nothing, um, probably something he should do is document his findings and possibly respectfully advocate for the patient's best interest.
Ethical principles to the options. Step 4 is applying the ethical principles to the options. Trevor needs to evaluate the circumstances and decide what is the appropriate way to move forward. His proceedings need to uphold his own ethical obligations as a healthcare provider. Patient autonomy, honesty, and non-malfeasance are all things that need to be considered in his decision-making process. In step 5, Trevor needs to make the decision. Trevor must decide how to act in a way that upholds his ethical obligations to honesty, patient autonomy, and non-malfeasance. This may be difficult as he is a new hire. His rapport with Dr. Reeves is not established, and with the doctor being in the position of power, makes Trevor's ability addressing conflicts difficult. In this circumstance, the ethics of the doctor is in question. We see that there is an abuse of power. How much more will the doctor do to Trevor if he confronts her? Now that Trevor has made his decision to confront the doctor, it is appropriate to do this in a private setting, not in front of the patient. After the patient has left, try to go up to the dentist and ask in a private way, it may be in the office or somewhere where you're not surrounded by people, that your clinical findings were a little bit different and you're wondering if maybe you guys could compare and contrast what you're finding. Maybe you're missing something, maybe this is a true ethical dilemma, but communication is key and you need to make sure that you're addressing the dentist in a way that is not obstructing their superiority or making it seem as though you're questioning their decisions. Even though you are, you need to come off in a professional manner that's not insulting. So with that being said, Trevor needs to implement his decision, try and gauge the outcome, and reflect how he can handle similar situations in the future. It is important to learn from the situation so he's more equipped to deal with it if it presents again in the future. Continuing, from this experience, Trevor would have learned how to judge character of the dentist, in particular, the type of care he wishes to present his patients should be in line or in mirror of that of his employer. So this shows that maybe the dentist came off originally when she hired him, that they would have the same line for patient care, but now that they're working in a clinical setting together, it maybe appears to Trevor that they're not, and conflict of interest will lead to more conflict and consequences. So there are two ways that the dentist could respond to Trevor. One would be in a positive manner, appreciating his professionalism and willingness to ensure that patient care is ethical and evidence-based. This would be a good way to strengthen their relationship in the workplace and reinforce a culture of honesty within the practice, while also upholding checks and balances. So the dentist is giving a diagnosis. You need to agree with that. That needs to be something that the two of you come to a conclusion together. If you're finding caries in the mouth before, pointing that out to the dentist, but also making sure that you're still seeing the caries that they might find after your clinical exam. Another way that the dentist could respond is negatively, that Trevor is questioning her authority. She might dismiss his input, criticize him for questioning her judgment, or even retaliate by creating a hostile work environment or terminating his employment. So if she does respond in a negative way, Trevor needs to stay calm, document what he's seeing, document the conversation, document the discrepancy in the clinical examination, and seek guidance from the Dental Ethics Board or state regulatory agency if he believes the patient is being harmed in any way. The consequences of this could include professional strain or even job loss, but it would uphold his ethical duty to patient welfare and integrity. So, like I said before, what would be the consequences? In the event that Trevor addresses the doctor, he might find himself in trouble in regards to his employment, punishment by the dentist, or creating a hostile work environment. And an ill start to their relationship as employee and employer may take root depending on how Trevor reacts to the situation. Given the context of the narrative, more than likely seeing the doctor is comfortable with the stronghold of vulnerable patients, she probably already has a system of abuse established. Therefore, how she runs her practice and how she treats her patients may already be under ethical scrutiny. Trevor bringing justice into the corrupt establishment may cause turmoil and will more than likely result in termination of his position should he do the right thing and stand up for his patient. So, obviously, what do you hope will happen? The obvious hope is that the doctor will respond positively to this ethical dilemma. No carious lesions should be filled without the need for them to be filled. It should also be described to the patient that there are areas of watches that can be resolved on their own without fillings. While it is not up to Trevor to hold up the ethics of the dentist, it is important to uphold his own ethics. In this situation, some things might not be able to be resolved, and Trevor and the dentist between Trevor and the dentist. If this happens and things do not resolve on their own, and Trevor is now working in a hostile work environment, or he does find that this is happening in the future, he can seek help from the dental board.